Okay, so good morning. So today we are doing a surgery in Sulis Hospital, and I want to show you a young guy who had a complex meniscal tear, and I want to show how a complex meniscal tear looks on MRI scan. So if you can kindly come close, it's so important that on a surgical scan, if you look, this is a normal articular cartilage, this is normal articular cartilage, this is a normal meniscus, and you can see how complex one tear is going here, one tear is going here. And then we will show you how we save this meniscus by repairing it with the help of stitches. So this young patient, we are about to start looking at the knee, and when we looked inside the knee, because of the meniscal tear, he had multiple synovial inflammation, which we cleared. And now we are going to show you inside the knee, if meniscus tear is delayed, what it can cause to the knee joint and how it can cause damage to the meniscus. If I show you the knee, you will see one thing which is very interesting. This is a probe, and if you see in a young age, because of his synovium, the cartilage condition is getting quite worn out. You can also see fluffiness on the meniscus. You can see inflammation on here. So if we look at the meniscus on this side here, we can clearly see that there is a degenerative tear somewhere here in the meniscus. Okay, so the purpose of showing this video was from the beginning to show you in a young guy how a meniscus torn is treated. As you can see, we went inside, we repaired the meniscus, and we have saved this meniscus to prevent him from future arthritis. और यही मकसद होता है सारा सर्जरी करने का, यहाँ करो या किसी भी कंट्री के अंदर, कि मैंने अपने पेशेंट्स को उसी तरह ट्रीट करना है ताकि उनकी नी सेव हो सके. I hope you enjoyed this video and will do more videos like that for educational purposes.